Hello everyone, and it is Tuesday. It is Facebook Live time, and today we are going to talk about why reaching out to a physical therapist like myself could be the best starting place if you hurt. I'm Dr. Jeanette DeWitt. I am a physical therapist, a certified athletic trainer, and also a fitness coach. And I also own DeWitt Physical Therapy and Wellness. Well, today we are going to talk about why reaching out to a physical therapist like myself is one of the best options you have when you hurt. Let's face it, there's a lot of information out there on the internet and out on social media, and it's not always accurate information though. I mean, do you really want to trust your aches and pains and your healing options with people you don't know? Or people who, are just random and just kind of searching themselves for answers, when you can actually get expert advice from a physical therapist that is local to you or even nationally. I know that I do video chats with people. I do Facebook. I have people commenting or contacting me through YouTube and asking me questions. So I'm not just local. I can answer questions for people in New York and Pennsylvania like I did last week. And can I treat them? I'm not licensed in those states, but I can certainly give them information. Or if they want fitness information, I can do video chat with them and I can watch them do techniques online and make sure they're doing it correctly so that they don't hurt themselves. When you're seeking out information, you want to make sure that you are looking at credible resources. And because of all the information on the internet and because of all the chats that are available at our fingertips and social media, sometimes the information that's being put out there isn't accurate and isn't credible. So it's important when you're talking about your health to seek out credible resources. When you seek out a physical therapist, they can help guide you to if they are the right place to start. For example, if I have somebody contact me and they're complaining they can't put weight down on their foot, they have a swollen ankle, they fell and they heard a pop, I am not the best place for them. They need to actually go get an x-ray and make sure that there's not a fracture involved, because I can't help them with that. However, if I have another person contact me, say they were running, they stepped off a curb wrong, and they felt a turn in their ankle, it's a little bit swollen, they can put weight on it, but it hurts, I'm the right person for them to start with, because I can evaluate them, I can look at their swelling, if they have that starting to puff up from the injury, and I can give them exercises or treatment to help that ankle injury heal faster. Now, there's a lot of places that people can start when they get hurting. You can start with a physician, you could start with a massage therapist, you could start with a chiropractor, you can start with a physical therapist. The reason I recommend a physical therapist, and yes, I am biased because I am one, but the reason I recommend a physical therapist is because we do so much that other disciplines can't do all at once. For example, I can do manual therapy and I can help joint issues and I can help joints move better. But I can also help muscle, ligaments move better too through manual work or hands-on therapy. In addition to hands-on therapy, I can prescribe the right exercises to complement the treatment that I am providing. So not only are you getting hands-on therapy, but you're also getting exercise that you can do at home so that you don't have to come to my office as often. And then as you heal, you can do more and more at home, and we kind of wean off of physical therapy and move more into a fitness, or into, if it's occupational, we move it more into occupational skills. Or if it's hobbies or recreation, we move more into hobby and recreation skills versus physical therapy rehabilitation. So physical therapists are a great place to start when you hurt, because we can walk people through their rehab, through their injury, through the healing process, and beyond. When you start with your physical therapist and you start with therapy as your starting care point, it's a very easy thing. Most states are going to have some form of direct access. What is direct access? Well, it means that you can see a physical therapist without a physician referral. In my state, the state of Wisconsin, I can evaluate and treat a patient without a physician referral. Other states may have different stipulations. So for some states, you may be able to be evaluated by a physical therapist, but you can't be treated without a physician referral. Or in some states, you can be evaluated and treated for 30 days. In my state, that does not hold true. I can evaluate and treat a patient without a physician referral, and I don't have a duration limit and I don't have a treatment limit. Now, if your insurance, if you're going to use insurance, then your insurance may have some stipulations. You may be able to be evaluated, but then you have to have authorization. Or you may be able to be evaluated and treated without a physician referral. Or you may have to seek a physician referral first before being evaluated and treated. Every insurance is different, and if a person is a self-pay patient, that means that they're electing not to use their insurance and they have more freedom of choice. They can go directly to the physical therapist in a state with direct access and be evaluated, be treated, and they don't have to abide by insurance law. They just have to, along with the physical therapist, have to abide by state law. If you're starting your care with a physical therapist, you're also going to get a holistic approach. I mentioned the hands-on therapy and I mentioned the exercise. None of these involve medication. None of these involve surgery. It doesn't mean, in many cases, it doesn't mean that you will need surgery, because physical therapy is often a great type of treatment that prevents surgery from being required. There are situations, though, that a person comes into my office and they do need surgery. So I don't want to dismiss a physician. I don't want to dismiss the wonderful skills and the great skills and services that they provide. I want to be very, very clear. It is up to the physical therapist to decide with the patient if they are the right place to start, or if the patient is better served seeking out a physician's care first, in the example of that possible ankle fracture. The other time that I would request that a patient seek out a physician first would be if they have other medical complications. For example, if they have high blood pressure that is out of control, or they have diabetes that is not stable. Those are things that I want a patient to seek out their physician, make sure all of that is on track, because exercise and physical therapy can influence blood sugar levels and can influence blood pressure. Exercise decreases blood pressure typically, and it can influence blood sugars. So those things need to be stable before beginning physical therapy. Now, in some cases, a person will come to me and I'll check their blood pressure and it's slightly elevated, and they tell me that they have blood pressure medication and that it's stable. I'm going to check their blood pressure every time they come in, because I want to know for myself if it's stable. And I have been able to influence people's decisions by them coming to me and measuring their blood pressure, and it's not stable. Every time they come to me, it's a little bit out of control. And so I work with their physician then to help them get that under control and get them connected. Now, what I mean about a holistic approach is that this is a conservative approach to treatment. Using physical therapy to help calm down pain and help stop you from hurting is a great alternative to pain meds, which can be addicting and have other side effects. So using a holistic approach, using a conservative approach with physical therapy, and improving overall health through physical therapy are three main reasons that physical therapy is a great place to start when you're hurting. What do I mean by an overall health benefit? Well, it's not uncommon for people who have been sedentary to do really well in physical therapy, and because they're not hurting anymore, they want to stay more active. They don't want to go back to the old way of being sedentary. They actually like doing exercises that reduce their pain, prevent their pain from coming on, and they want to stay with that. And that is ideal. That is actually what is completely recommended. When patients go from rehabilitation and move into fitness because they don't hurt anymore, now they are more likely to reduce their risks of heart disease, reduce their risk of stroke, reduce their risk of obesity because they can manage weight through exercise. They can also reduce the risk of some forms of cancer, and they can reduce their risk of developing diabetes, or they can change the way they have to manage their diabetes. These are all things that can be a great side effect, if you will, from experiencing physical therapy. And I've seen it time and time again that people who have been hurting for years, they come into physical therapy and their pain goes away, and now they can be more active. And now they can manage their weight better because they can be more active and they're moving better. And when that happens, then they start to look at their nutrition, they start to look at other lifestyle stressors, and they start to change some of those things, and they develop better, healthier habits. Let's just face it, if you're in pain when you move, it's really hard to be motivated to move. And physical therapy can help with that. When you move, you're going to improve blood flow, you're going to decrease the risk of blood clots, and you're going to improve your mood. So physical therapy is beyond rehabilitation. It's treating the whole person in rehabilitation, throughout the healing process, and after rehabilitation to promote a healthier lifestyle. For all of these reasons, physical therapy is a great place to start when you're hurting, because you kind of have a snowball effect with physical therapy. You get on track, you get into a routine of doing the exercises, you get into a routine where you're accountable with a healthcare professional who is an expert at knowing how the body moves and how your body specifically is going to respond to treatment and to movement, and reducing pain, improving mobility, and increasing strength. So what do you have to do to get started in physical therapy? Well, all it takes is a phone call. If you're not local, I'm in Wisconsin, if you're not local, call a local physical therapist. Ask them specific questions. Do they put their hands on you? Will they touch you? I don't know how many times I've had a patient come in and say that their physical therapist before seeing me never put their hands on them. I don't understand that. I'm not downplaying anybody, and I'm not criticizing anybody, but we're physical therapists. We put our hands on patients and we give them the time they need. We give their body the time it needs to heal, and we use all the tools in the toolbox, whether it's exercise, whether it's hands-on therapy, whether it's improving balance, or whether it's just educating someone about good, healthy habits in food, nutrition, and water, and exercise. These are all things your physical therapist, when you hire a physical therapist, should be talking with you about. And it just takes a conversation. Why not start a conversation by, you can give me a call, you can email me, or you can go on my website and take a look around. My number's 262-842-2220, or you can email me at Jeanette at dewittptwellness.com, or you can take a browse onto on my website and look at www.dewittptwellness.com. Thank you so much. Physical therapy is a great place to start for physical therapy, rehabilitation, fitness, and overall health. I hope you consider it. Thank you.